I'm very thankful to Sanjeevani for inviting me to this webinar. Now, I'll start with what Madam said in the welcome address. Madam said that if you know somebody who is suffering from cancer, refer the person to us. I think this is the beginning of closing the gap. Madam did not say that we do not provide service to the rural areas. She did not say that we do not go to tribal areas. She did not say that we do not serve the poor. Okay. She said, if you know somebody, you refer them to us. We'll be glad to help them. Okay. So maybe closing the gap begins from there. And I am really thankful that, we are able to work with Sanjeevani. We have been placing our social work students, social work interns with Sanjeevani for a very long time. The other programs of Sanjeevani also actually closes the gap. The other program that our students were involved during the pandemic especially was the program of reaching out to students of schools and colleges and inform them about how prevention is possible. Okay, so the webinars that were conducted were all very well conducted. Many students across the country, we saw, I personally supervised students and I saw that, they had reached out to almost every state of the country. And, in spite of the pandemic, Sanjeevani did not stop working. Webinars continued. Okay. So the activities that Sanjeevani actually has been doing, okay, today for this year, the theme may be closing the gap. Sanjeevani has actually been doing it for a very long time. I would also like to share something that being social workers, working with people at the grassroots level, supervising students, who work with people at the grassroots level, we understand that it is very essential that we move down, to the grassroots people and, bring services to them. Now, we have just been to our university from our department. We have just been to an organization called Shrima Muhila Shumiti. They work in Noihati. So we have been there with them. We stayed for 10 days with them and they have started a very nice program. I would like to share that. And, they are actually again closing the gap. They have started working with an oncologist. They have adopted 2 villages in Nadia district. And with the help of their own staff, they are reaching to every household of these 2 districts. They are screening women there. They're informing women, especially breast cancer. They're informing women about, how self-detection can be done. And then identifying cases, treating those patients also. Okay. So this is a very good example that we saw. And I, as a social worker, I'm very happy that, this initiative has started. We had previously also spoken about closing the gap. And, I see that, that is actually happening. Okay, following Sanjeevani, or maybe they may not be knowing Sanjeevani, but there are organizations who understand that, it is very important to go down to the remote areas where people do not actually get services. The other thing that I would like to share and, wind up my conversation here is that, today in the morning while going to the newspaper, it's a Bengali newspaper, and we saw that Chittoranjan National Cancer Institute in Kolkata. Okay, they have started with a very nice service. They have started with a bus that will go to the districts of West Bengal to screen, especially women. The focus is on breast cancer. They will have doctors and then, technicians and health staff. They will conduct mammography, okay, and identify cases and help them to get treatment. They have also mentioned in the newspaper article that, they will also focus on cervical cancer and oral cancer. Okay, so this actually is a very good news for all of us. Actually, this is a very good example of, how we can close the gap. Now, from the grassroots level, a few, 2-3 more points I'd like to add is that, we see that in rural areas, use of tobacco products. Okay, it is there everywhere, but we see them also there in rural areas. Okay, so awareness programs regarding how prevention, how this addiction is harmful and may cause cancer, maybe we should be done, more intensively, maybe. Okay. Pesticides and insecticides, okay, all this is also harmful. So there needs to be awareness regarding this. Also, waste disposal, especially these heavy metals, okay, separating them, which causes harm to, health hazards, okay, also has to be taken up. Now, all this can be done when we start working also with the government. Now, again, Sanjeevani is also doing that. We would also like to partner with Sanjeevani in doing all this. As I had previously also mentioned that in Newtown, St. Xavier's University, Kolkata, we have adopted 5 villages. We'd like to work with Sanjeevani in prevention, detection, and treatment work. Thank you so much for inviting me. I hope that Sanjeevani will continue to provide very quality service, very good service with care, with love, with compassion to the people of our country. Thank you so much.